Okay, let's make sure we are going live before we dive into this topic tonight. Let's see. Okay, so we're live. Sorry about the technical difficulties, guys. All right, so for those of you that are new to the Mom and Baby Nutrition Support Group, my name is Alex Gardner. I am a registered and licensed dietitian, and I specialize in prenatal, postpartum, and infant feeding. And tonight, we're going to talk about a really important topic about why nutrition is important. So every week, for those members that are new to the group, every week we do a live training right here in the group. You can see our past live trainings if you go to the guide section at the top of the group page. You'll see lots of great resources there. But sometimes I get asked, why do I might need to partner with a dietitian and talk to a dietitian? My pregnancy is going great, or I'm not pregnant yet, so it doesn't really matter. Tonight, we're going to talk about why you might think you don't need a dietitian, but why it is so important to talk to a dietitian before, during, and after pregnancy. So what we do or do not put in our bodies impacts our health. Even when we are not pregnant, nutrition plays a really big role. Poor nutrition can lead to several negative outcomes. So we're talking to things like tooth decay. Did you know if you don't have enough calcium stores in your body, but when you're pregnant, your baby needs that calcium. So some women, when they're pregnant, experience tooth decay. And what that's doing is your body is pulling the calcium out of your teeth, out of your bones, to make sure that your baby gets it. You might have high blood pressure. You might have high cholesterol. You might have heart disease. It can lead to strokes. It can lead to type 2 diabetes, osteoporosis, cancer, depression, cognitive decline. All sorts of things can happen because of poor nutrition. But the opposite is true too. When we eat healthier, we are healthier. Good nutrition can help us have normal blood pressure, normal cholesterol levels, higher energy levels, a better mood, and it can even help protect against cancer and cognitive decline like Alzheimer's and dementia. And this is why it is so important that we take nutrition seriously. So let's take a look here. Preconception. Here are some numbers, and these are astonishing numbers. 11% of women, and these numbers, okay, let's say these numbers are of American women of reproductive age. So typically like 14, 15 up to menopause, right? So when you start your period up to menopause, 11% of women in America that have reproductive age are iron deficient. 42% are vitamin D deficient. 60% of non-Hispanic white women are folic acid deficient. 79% of Hispanic women are folic acid deficient, and 81% of non-Hispanic Black women are folic acid deficient. And we know that folic acid is so important before you even become pregnant, because when you become pregnant, the neural tube of your baby, so all the way from the brain, all the way down the spine, all the nerves and the brain of your child are developing in that first 4 weeks. And most women don't even know they're pregnant until after the neural tube has finished developing. And this is why it is so important to make sure that we have good nutrition before we're even pregnant, because by the time we realize we're pregnant, a lot of important stuff has already happened. We also see that 25% of women in America are overweight and 23% are obese. And poor nutrition during the prenatal period can cause lots of problems and complications before pregnancy, during pregnancy, and after pregnancy. So let's talk a little bit about those complications. So before pregnancy, poor nutrition in the mother, you're more likely to have a chronic disease. You're more likely to be fatigued. You're more likely to gain more weight during your pregnancy and retain it after your pregnancy. You're more likely to have problems with fertility. You might not necessarily be infertile, but you might have a hard time conceiving. You might get gestational diabetes and gestational hypertension during pregnancy because of your nutrition status before pregnancy. And you might have to have a C-section. For babies, poor nutrition before pregnancy may lead to you having a miscarriage or a stillbirth. It may lead to your baby having a low or high birth weight. It could possibly lead to your child having a chronic disease throughout the rest of their life. And it most certainly could lead to your child having a birth defect, like a neural tube defect, with all the women that are folic acid deficient in America. And it's more likely that your child would be premature. But the good news here is that if you're not pregnant yet, but you're trying to conceive, that you're able to address any conditions that you have before pregnancy and get those managed before you become pregnant, which gives your baby the best chance of being healthy. And we have this quote from the CDC that I really like. And it says, preconception health gives babies the best gift of all. It gives them the best chance for a healthy start in life. And I think that's really important. Then we're going to look at what can happen when you have poor nutrition during pregnancy. For moms, you're more likely to be anemic. You're more likely to have low energy. You might have preeclampsia, hemorrhaging, which means excessive uncontrollable bleeding, and you could even possibly die from these conditions like preeclampsia and hemorrhaging. So maternal morbidity or maternal mortality is higher in women that have poor nutritional status. But what about in babies? If you have poor nutrition during pregnancy, your child is more likely to be born as a stillbirth, more likely to have a low birth weight or even a high birth weight. They're more likely to have muscle wasting, which means the muscles aren't developed well. They're more likely to have developmental delays. They're predisposed to being obese and having type 2 diabetes later in life. They're predisposed to having poor emotional control and poor cognitive ability later in life. For example, when you are pregnant, your baby will take what it needs from you. If you have low nutrient stores, you become deficient. I talked about how a lot of moms will have dental problems during pregnancy. And that's because your body is pulling calcium wherever it can, and that includes your teeth. A lot of moms are iron deficient because of the extra blood that your body is making, and this causes you to have a lot of nasty symptoms. Moms with anemia have longer hospital stays, they have more hospital admissions, they have higher rates of preeclampsia. Babies born to moms with anemia usually weigh less and are usually preterm. So making sure that you're eating a well-balanced diet provides your body as well as your baby's body the nourishment that you need to feel good, be healthy, and grow a healthy baby. And that's what's important. And I know that's what your goal is. And this is important because your baby is building its nutrient stores for the first 6 months of life while it's inside of you. So if your baby is born with very little to no nutrient stores built up, then they're going to be born undernourished. So eating healthy helps your baby be properly nourished with a well-stocked store of nutrients for the first 6 months of life before you introduce solid foods. So for example, babies will get all the iron they need for the first 6 months of life before they're born. But 15 to 20% of pregnant mothers in the US are iron deficient. That can mean that your baby won't get enough iron stores for the first 6 months of life. And there are many, many, many costs that are associated with conditions caused by poor nutrition during pregnancy. For example, the average cost of the hospital stay for a low birth weight infant is $27,000. And that doesn't include the frequent doctor visit follow-ups, the interventions that your baby may need, any medication that they may need. Then the baby is going to start life out with low nutrient stores, which can lead to other issues later in life for your child. Now, think about the cost of a child that are associated with a child who might have developmental delays and might have lower cognitive ability. The cost associated with this can vary broadly, and there's likely going to be increased medical cost related to therapies like speech and occupational therapy, There's also going to be costs associated with having a skilled caregiver that is needed for the child for the rest of their life. So whether that be a parent who might have to quit their job and be a full-time caregiver, or the parents paying for a caregiver when the parents are away, these are all costs that are associated. And so these are some really important things to think about why nutrition is so important and why an investment in your health before and during pregnancy can lead to a better quality of life for you and your child and saving money in the long run. So let's talk a little bit about after pregnancy. Poor nutrition after pregnancy can be more likely for mothers to have postpartum hemorrhage, more likely to be low energy. You're more likely to have postpartum depression, and you're more likely to not be able to lose the weight that you gained during your pregnancy. For babies, it can be poor weight gain. It can be dehydration, which can lead to hospitalization. And it can even be poor cognitive development. So for example, your child not getting the nutrients they need during their early start in their life, maybe they're not reaching their full cognitive potential. And they may even have nutrient deficiency. But this is important. So what about toddlers? Okay, we talked a lot about mom before, during, and after pregnancy. We talked a lot about the baby during and after pregnancy, but what about when they become toddlers? So I have some figures here from a recent webinar that I attended. This is some scary information. So 27% of 12 to 18-month children in America do not consume vegetables within a 24-hour period. Almost 30%, 29% of toddlers 18 to 24 months do not consume vegetables in a 24-hour period. The white potato is the most popular. And if you took the white potato out of this equation, that would mean 40% of children do not consume a vegetable within a 24-hour period. Toddlers. And think about how fast little toddlers grow. They grow so fast and they need all the nutrition that they can. But 2 out of 5 toddlers are not eating any vegetables. So what does a diet with poor nutrition do to these toddlers? Well, 1 out of 8 toddlers suffer from vitamin D deficiency. Okay. But, that may even lead to things like rickets, which is bone, like where the bones of your legs bow in. Okay. Did you know that only 80% of children ages 1 to 2 do not meet the needs for vitamin D? And 87% of children aged 2 to 3 do not meet their need for vitamin D deficiency. What about iron? About 7% of children aged 1 to 5 are iron deficient. And this goes, as this slide says, beyond the brain, okay? It can lead to respiratory tract infections. It can lead to heart failure in children. It can lead to inflammation with the microbiome. It can even lead to malnutrition and low immunity through gastroenteritis. So these are all things to think about. Now, this is a really eye-opening quote. This is directly from the CDC's website. Okay, people diagnosed with diabetes incur, on average, $16,750 annually in medical expenses. Okay, and that isn't just all out-of-pocket costs. Okay, some of that's going to be covered by insurance, but it depends on what your insurance is. If you have gestational diabetes, you are more likely to develop type 2 diabetes after pregnancy than a mother that did not have gestational diabetes. So the risks are 20% higher you're 20% likely to get type 2 diabetes 10 years after your pregnancy if you had gestational diabetes. You're 29% likely to get gestational or type 2 diabetes 20 years after your pregnancy if you had gestational diabetes. You're 39% likely to get that type 2 diabetes 30 years after your pregnancy. You're 48.6% likely to get it 40 years after your pregnancy, and you're 58% likely to get type 2 diabetes 50 years after your pregnancy if you have gestational diabetes. And these are shocking numbers. And children born to mothers that have gestational diabetes are twice as likely to develop type 2 diabetes by the age of 22 compared to children born to mothers without gestational diabetes or diabetes. So let's run some math here. Let's say your child is 22 and develops diabetes, right? Okay. Say your child lives to the age of 82. That's 60 years difference. So 22 to 82, that's 60 years of living with type 2 diabetes. That would mean that your child is going to be spending $1,005,000 over 60 years in their lifetime on gestational diabetes or on type 2 diabetes. That's $1 million that is going to be spent on your child or from your child throughout their lifetime. Now, let's say that you develop type 2 diabetes when you turn 40 and you live to be 85. You will be spending over $750,000 for your diabetes. And diabetes, besides the medical costs, can lead to things like stroke, heart attacks, kidney failure, neuropathy. This can lead to toe, foot, and leg amputations if it's not well controlled. So what I'm trying to say here is that it is very, 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 very important for the well-being of you and your child to prioritize your nutrition. And I'm not doing this to scare you. Because why? Because the good news is you are in this group. And in this group, I'm going to provide you resources to help you before, during, and after pregnancy so that you can make sure that you have the best nutrition for you and your little one, so that you are investing in your health and your child's health before you conceive, while you're pregnant, and even after. So that way you are able to live the best quality of life that you can have, as well as the best quality of life for your child. And investing in your health now is going to save you or your child $1 million, apparently, theoretically, okay? Don't quote me on that. But it's going to save you so much money in the long run. And even if you put money aside, you're going to have such a better quality of life. You're going to be able to do all the things you want and love to do. And this is why it is so important to make sure that we are prioritizing our nutrition. So I don't want to scare any of you guys tonight, because I did a lot of scary numbers and a lot of scary facts. But like I said, the good news is you're in this group and you have me, you have the support system of the other moms in this group, right? And we can take care of ourselves before, during, and after pregnancy so that we can avoid these complications, so that we can have a better quality of life. And that is why it's so important to talk to each other, to talk to me, and to make sure that we're prioritizing our health. So if you're interested in learning a bit more about the resources that are in this group, or you're interested in learning what an individualized or personalized approach for your specific pregnancy journey and your specific lifestyle and situation is, feel free to reach out to me, or you can click the booking link in my the header of the group. The next step would be we book a 15-minute phone call. Now, don't worry, this phone call is absolutely free. I'm not going to try to sell you anything on this call, okay? It's just so that I can better understand your goals and your situation in life and where you want to be and why it's important to you. And then from there, if we decide together that you'd like to move forward, we can book another call and we can discuss that. So, this is really up to you and the value that you place in nutrition. So we're here together to help each other, and we're here together to lift each other up and bring each other together. So mamas, if you have any questions, please feel free to put them in the comments, reach out to me directly, and I can see how I can help you in your journey and help your little one. I look forward to talking to you all, and I will see you all next week on our live stream then. Have a great week, mamas.